All right, you're all set.
All right. Good afternoon, everyone. So this presentation will be about an environmental health perspective on food systems. And our learning objectives are for you to be able to list 2 examples of how an industrialized food system results in adverse health outcomes in the United States, and to identify 2 actions that health professionals can engage in to create a healthy food system at an institutional or organizational level. The scope of the presentation, we'll talk a little bit about what we mean by food systems, about healthcare advocacy, healthcare concerns related to our industrialized food system, and we'll touch a little bit on climate change and pesticides. And then we'll talk about how healthcare providers can help to make change. So at the Ecology Center, we take a systems approach to issues of food and health. While a great deal of food and fitness advice is aimed at individuals, as Becca mentioned, in dealing with toxics, a lot of messaging and communications is aimed at what individuals can do. We think it's important to remember that individuals are embedded in a progressively nested sort of social and ecological systems that involve cross-level relationships. And this image kind of illustrates that individuals are members of families, which are in turn members of communities and society, which are embedded in a particular ecosystem. So the systems approach broadens our sphere of concern beyond just individual responsibility and illuminates many different avenues for creating positive change. At the community and society level, for example, culture, food advertising, health, neighborhood food access, industry choices, and public policy are just some examples that greatly influence the decisions about what to eat that individuals make. Human health and well-being are dependent on the health of the ecosystems in which we're embedded. The ecological impacts of industrial agriculture, which we'll talk more in detail about, result in health concerns for both individuals and communities. So, healthy food. The nutritive of food is essential, but if we only focus on the food itself, we are missing an important piece of the picture, and changes that can be made that influence how food affects us, our health, and the health of our environment. The systems approach is the basis of our healthy food work at the Ecology Center. We hold that healthy food is defined not only by nutritional content, although that is essential, but it must come from a food system that is ecologically sound, economically viable, and socially just. So I'm using this word food systems, and I want to explain what I mean by that. A food system, excuse me, a food system consists of all the processes and infrastructure that go into feeding a given population, and that can include growing and harvesting, processing, packaging, transportation, marketing, consumption, and the final disposal of food and packaging waste at the end of the process. A food system also includes all the inputs that go into creating food, and that can be fertilizers, pesticide, water, machinery, and money. Outputs are the crops that are generated and the waste materials that are created in the process. Sorry. Also, I forgot to mention that, that a food system operates within a political, social, economic, environmental context. And so food systems vary from place to place and are in many ways a reflection of a society's values. And also includes human resources, so the labor that creates the food, that harvests the food, that runs the machinery, and researchers who help with research and education about our health system. They're all part of the system. And food systems are often illustrated with a graphic like this. So there's many different examples that we could show, but this is just an example of showing the complex and interactive nature of the various components, that the resources that we mentioned, the waste, eating, processing, producing, with sort of trade and transportation at the center. When we take a holistic approach to food and health, it allows us to move beyond a purely nutritional model that deals with the nutritional aspects of what we eat, or a medical model that treats the symptoms related from complex systemic problems, to promoting health at many different levels. So our food system is increasingly industrialized and globalized, but it's been transformed really recently in human history in the last 150 years. Our food system has transformed from farming, what we used to see like this, where we think of, a romantic notion, perhaps a farmer with a hoe, some chickens roaming around, some plants, sort of small scale, human scale agriculture. In the last 150 years, since 1870, when 90% of the US population lived on farms, it is currently 2%. And we have transformed from this sort of small family farm model to very large industrial agriculture, and the number of farms has dwindled. In 1940, the average farm was 149 acres. By 2009, it was over 400 acres. And large industrial farms now average about 1,600 acres. So this very, very rapid transformation that has been one model throughout most of human history has been very rapidly changed, and that has or like this, large industrial factory model farming. And again, this has profound impacts on the nutritional value of food, the diversity of food available to us, as well as the implications for environmental quality and human health. Our industrial or conventional food system favors large-scale monoculture agriculture that uses industrial machinery fueled by fossil fuels that contribute to climate change.
Mara or I, if you wanted to take 5 minutes to email your presentation, we could forward the slides if that's going to be helpful.
Okay, let me do that.
Yeah,
sorry.
So take 5 more minutes, folks.
Sorry. And it's really good at producing large quantities of highly processed, calorie-rich, but nutrient-poor food, which is not good for our health. And therefore is a major driver of obesity, many kinds of cancer, malnutrition, contributes to diabetes, cardiovascular disease, and other chronic diseases. So in many ways, next slide, our health, our food system in many ways is broken with really serious consequences for health, for environmental quality, and for the ability of many people to feed themselves. Our goal is to create alternative food systems that are healthier for ecosystems, people who work at all levels in the food system, and people who consume the food. This approach is summarized by one of our local businesses that is present both in Detroit and Ann Arbor, Avalon International Breads, and their motto, Earth, Community, and Employees. Next slide. So we focus on healthcare advocacy because we know that in many ways our food system is broken, and that the healthcare sector bears the burden of treating the health problems that result from this system. Hospitals and healthcare professionals can be leaders and advocates for a food system that promotes public and environmental health. You have the opportunity to use your voice, which carries moral authority and the purchasing power of the healthcare sector to create change. Healthcare professionals have credibility, influence, and expertise. When you speak, people listen. Next slide. The case of tobacco is an excellent example. The health community advocated for environmental changes that made tobacco use more difficult, and it worked. It took multiple types of intervention, including secondhand smoke regulation, changing hospital environments, and addressing advertising campaigns. Similarly, with our food system, it will take many interventions at many different levels. Next slide. So we're going to look at a couple of different environmental health concerns within our food system. Next. To get a better understanding of our food system, let's look at an example of Michigan apples. I bet you don't know this. Just a few facts about Michigan. Michigan is the nation's third largest grower of apples. Over 7.5 million apple trees were in commercial production, covering 37,000 acres on 950 mostly family-run farms throughout Michigan's Lower Peninsula. Michigan harvested approximately 903 million pounds of apples in 2006, with more than 20 different varieties commercially produced and an average of 700 to 900 million annual impact on Michigan's economy. So you can see that apples are one of Michigan's largest and most valuable fruit crops. So about 60% of those apples go into producing pie filling, fresh cut slices, applesauces, jellies, butters, juice, cider, and vinegar. And Michigan is the largest producer for slices of commercially prepared apple pie. So just a few fun facts from pure Michigan. So you can see from this example, next slide, that our food system is really complex. And just looking at one example of apples, if you look through the whole process from growing, harvesting, washing, grading, packing, distributing, processing, packaging, retailing, all the way through to composting, at each one of these steps in our food system, there is an opportunity for improving or harming environmental health. For example, in harvesting, people who work in the food system, so farm workers who might be harvesting those apples, could be exposed to pesticides. In packaging, there might be chemicals that people are exposed to, or toxic chemicals that people are exposed to in the packaging materials that can leach into the apples or be exposed to the workers who use them. In consuming, if those if those apples were grown with pesticides, then the people who consume them can be exposed to those. So there's, in every step along the way, there are opportunities for environmental and health impacts. So next slide. So some of the key environmental health concerns with our industrialized food system are, as we mentioned, you heard from Becca, exposure to toxic chemicals. We also have antibiotic resistance, which is due to the routine and intensive use of antibiotics in animal feed. And antibiotics use in food production represents 80% of all the antibiotic use in this country. And that includes medicines which are critically important to treating bacterial infections in humans, and they're becoming less effective with overuse in agriculture. Foodborne illness is another environmental health concern with our food, and large-scale animal production facilities that crowd thousands of animals into confined, often unsanitary conditions result in ideal conditions for the development of pathogens such as E. coli, salmonella, and others. There's also genetically modified organisms. So there's a lot of concerns about the ecological and health impacts of these, which have increased in our food supply. Most of the wheat, corn, and soy grown in the United States at this point is genetically modified. So unless you find wheat, corn, or soy that says that it's not, then you should assume that it is. And we know very little about the health and ecological consequences of this widespread use. Environmental degradation results from the use of pesticide, chemical fertilizers, fossil fuels that create air pollution, and livestock intensive production, which contribute to soil erosion and contamination of land, air, and water. Also, consumption patterns matter. The prevalence and marketing of highly processed food and other foods of low nutritional value has changed our consumption patterns, making it more difficult for people to make healthy food choices. Next slide. So this just shows that within our food system, at each one of when we looked at the example of apples, each one of those phases of the food system, that there are sort of specific environmental health concerns that arise in that area. So in production, we're looking at pesticide use, chemical fertilizers, antibiotics, in some case arsenic, which is used as a pesticide as well. In processing, becomes concerns about mercury, which is, and again, foodborne illness, which I've already mentioned. And we mentioned packaging, Becca mentioned bisphenol A, which is in canning, but also in a lot of can linings, in other aspects of packaging, and transportation, which where we find many, many miles of food that travels and the air pollution that comes from the vehicles transporting them. Widespread use of plastics leading to large volumes of waste is part of that part of the system. And in consumption, we have concerns, as I mentioned, about fast food, sugar-sweetened beverages, high fructose corn syrup, marketing, and obesogens. So there's chemicals that are used in the food system that actually contribute to us becoming more obese. Next slide. So when we think about, hang on just a minute, losing my place here. When we think about health concerns in our food system, climate change isn't necessarily the first thing that comes to our minds, but climate change is an increasingly urgent public health issue. Sorry. And there's a great variation by country and region, but 1/3 of all human-created greenhouse gas emissions that are driving changes in our climate come from agriculture, according to recent studies. And healthcare providers have an important role to play in addressing the health impacts of climate change and promoting a low-carbon diet that reduces climate change greenhouse gas emissions and is better for our health. Next slide. I'm going to go to the next slide. Next slide. Yeah. So we can look at how our food system impacts the climate, and we can also look at how our climate and climate change is impacting our food system. So starting with our food system contributes up to 30% of greenhouse gas emissions that cause climate change. And a lot of that results from clearing of forests for new agricultural land, and especially for livestock production. And methane emissions. Methane is a much more powerful greenhouse gas contributing to climate change than carbon dioxide. And that results from livestock and from rice paddy production. Our food system also accounts for 80% of global deforestation, which is another way in which climate change is occurring. And our food system uses 70% of the world's available fresh water for agricultural production. So this is just from the Intergovernmental Panel on Climate Change that shows some of the connections to greenhouse gas emissions from cows, as I mentioned, from rice paddies. Fertilizer use is also a contributor to greenhouse gases. And then anytime we're harvesting biomass, we're releasing carbon dioxide into the atmosphere. Next. So this shows that certain kinds of protein have different kinds of greenhouse gas impacts. If you look at beef and lamb, those are the greatest impacts on carbon, kilograms of carbon per amount of protein produced. So those are very, very carbon intensive. And whereas you look at the bottom, you have tofu, beans, and nuts, which are all plant-based proteins. Those have very, very low carbon impact. And so we can have an important impact by reducing the amount of particularly beef and lamb, and as well as farm crustaceans that we include in our diet. Next. I think my slides are a little out of order here. I may have just have sent you the wrong. Oh, here we go. How climate systems impact. Which slide is not showing? Okay. So just give me a second here. These are not in the order that I was expecting them. I'm not sure what happened here. So we're looking at how our climate change impacts our food systems. We know that there are potential for increased temperatures, drought, and flooding that already have and will continue to challenge farmers' ability to produce, store safely, and distribute food, with severe impacts on food availability, global food prices, and boosting risk of foodborne illness. And climate change is expected to result in increased food insecurity, even in developing nations. An example that we've seen recently of agricultural pests that has been changed very dramatically because of climate change is climate change altering the ocean currents around Africa, resulting in a plague of hundreds of millions of desert locusts from Ethiopia and Somalia moving into Kenya. decimating farmland and threatening an already fragile region. Next slide. Looks at some of the climate change impacts. So we have changing weather patterns, as we mentioned, increased heat, which can lead to poor air quality. And I think that Alexis is going to talk in more detail about this. So I'm just mentioning it here, that increased heat also leads to increased precipitation, and with that flooding, which of course we've seen a lot of in the last year. And if you remember, just a few years ago in Michigan, we had farmers that were unable to harvest their crops because there was too much heat and drought. And then last spring, there was so much rain that throughout Michigan and Ohio, many farmers had trouble even getting their crops into the ground because of flooding. Drought and desertification is the result of increased temperatures as well as superstorms that are very destructive and can contribute to crop damage. So insect-borne diseases are also expected to change and are changing with increased temperatures. And then there's also psychological health impacts of climate change. So, mental stress, anxiety, depression, PTSD, not all that different from coronavirus, I guess. Next slide. This is just an example very recently from Detroit of flooding that happened right here in the west side of Detroit, where cars couldn't get through last year. Go ahead, next slide. And that's just an example of a superstorm over the Great Plains in the United States. Next slide. And our temperatures are very dramatically changing, and this is some data that shows that our changing Michigan winters will be more like Missouri by 2095, and our summers can be expected to be almost like Arkansas by the same time. And imagine what that is going to do. These kind of very dramatic changes will do to our food system. Next. So I want to say a few words about pesticides in food production. Let's see. So pesticides are used in many settings in our homes, workplaces, and parks, but approximately 80% of all pesticide use in the United States is directly related to agriculture. Next slide. Because pesticides are so widely used in our society, it's very easy to forget sometimes that by design, pesticides are chemicals that are intended to kill living organisms. The term pesticide refers to substances used to control pests, which can include insects, weeds, fungi, and rodents. Next. There are several major categories of pesticides used. Each has differing degrees of toxicity, and each have differing impacts on human health and the environment. The health impacts of many pesticides that are widespread use are not fully studied or understood. Next. And the health effects depend, as I said, on the type of pesticide and maybe the result of acute or chronic exposures. And some, such as organophosphates, affect the nervous system. Others can irritate the skin or eyes. Some pesticides are known are potential carcinogens, and others affect the hormone or immune systems. Go ahead, next. Also, research indicates that chemical pesticides used in food and water can be obesogenic, as I mentioned, altering metabolism in ways that increase weight gain. Studies have shown, for example, that the herbicide atrazine, which is used in apples, has been linked to increased BMI in children and insulin resistance in rodents. Pesticides, I'll go back once. Pesticides can get into our food, water, and our bodies, posing a threat to all of us, but farm workers face the greatest threat of suffering from pesticide-related illness compared to any other group. A 2001 study, which is a little old now, but showed that cancer among 146,000 California Hispanic farm workers who had been United Farm Worker members showed that compared with the general Hispanic population, they were more likely to develop certain kinds of cancers, leukemia by 59%, stomach cancer by 70%, cervical cancer by 63%, and uterine cancer by 68%. It's important to note that agricultural workers are excluded from the production or the protections of the National Labor Relations Act and are exempt from many of the protections under the Fair Labor Standards Act, as well as many state protections. So when we think about our food system and who is most impacted, it's really important to remember the people who are at greatest risk for higher injury and chronic illness effects, and that is farm workers. 1/3 of all crop farm workers work for employers that are not held accountable for complying with basic safety and health standards. So this is really important as we think about justice in our food system. Next. And just a word about pesticide and bees too, because bees are critical pollinators of a large percent of agricultural crops. But the widespread use of neonicotinoid pesticides is considered to be an important factor in the dramatic decline of bee populations. And this has very important implications for human health and agricultural production. Recent studies by European scientists have discovered that bee populations are experiencing a resurgence after 3 nicotinoid pesticides were banned by the European Commission in 2013. Unfortunately, all 3 of these are still heavily used in the United States. Next. So Becca already sort of touched on this, but I just want to reiterate in the context of the food system that food matters and nutrition matters as an important element of human healthy development. But there's also vulnerability, and the fetus and young human are uniquely vulnerable, and the timing of those exposures is important to their impact. Next, thank you. So this is kind of a crazy slide. I like to show it though because it illustrates the point of the complexity of our food system. This was a result of a study that was commissioned by the United Health Group, one of the major US insurance companies, and they funded MIT collaborative initiatives and Columbia Urban Design Lab to take a systems approach to the obesity epidemic. And this is what the result was, this sort of systems map. And I don't expect you to memorize all of this, but the important thing is that if you look at the top, you see in a little orange box there, it says Food and Farm Bill. And what their systems analysis determined was that the Food and Farm Bill is the driver of our entire food system in many ways. And if you look down, straight down that arrow, it says subsidies for farmers. And then you straight down to the next 5 highly subsidized crops. 85% of US subsidies go to corn, cotton, wheat, rice, and soybeans. And that these are the factors that lead down to the very bottom where you see the orange box that says obesity. That all of this very complicated system is ultimately driven by our policies at this federal level about what we grow and what we subsidize, and the fact that we subsidize these commodity crops, corn, wheat, soybeans in particular, that are the drivers of the food system, and not things that we consider specialty crops, like all the things that keep us healthy, like all the vegetables and fruits. So the Food and the Farm Bill lays at the foundation for how healthy Americans will be. It creates the default conditions for what we eat and foods America produces. Its largest slice, the nutrition title, which includes SNAP, the Supplemental Nutrition Assistance Program, determines to a great extent foods bought and eaten by lower income Americans in particular. So it should be understanding the Farm Bill, which currently isn't part of a curriculum for most health professionals or dietitians. This should be part of our understanding. There are many great resources that can help us understand the relationship between the Food and Farm Bill. And if you're interested in that, we can give you more resources for that. Next slide, please. Next, keep going. I'm going to skip these. Keep going. Okay, so I just want to reiterate this point that, in light of this sort of very complex system, and the fact that our health system tends to focus on sort of the top of the pyramid. If you look at this as the CDC, Centers for Disease Control, sort of pyramid of impact, our health system tends to focus on the examples at the top of counseling and education and clinical intervention. So things like, you know, advice to eat healthy foods and be physically active. Whereas if we look at, you know, that previous slide with a complex food system, we know that changing the context and changing the social and economic factors are going to have the greatest impact on the most number of people. And so we want to take the systems approach and always be thinking about, you know, where in our food system can we be intervening, and how do we sort of move upstream away from the sort of individual individual advice, which is important, to something that is really impacting across the scale to everyone. Next. So also it's important to recognize that the healthcare costs that we talked about that result from sort of our broken food system, and the food costs, the environmental and health costs of this, are externalities that are not reflected in the price of the food that we eat. And the healthcare sector is bearing this burden of the cost of food-related disease. Health professionals, nurses, dietitians, physicians, public health workers, social workers, and others every day see the downstream impacts of our food system, whether obesity, diabetes, malnutrition, heart disease, and yes, even climate change, are the costly consequences of a food system that favors poorly processed, nutritionally poor processed foods and relies on the heavy use of pesticide, fossil fuels, and other chemicals, and on other unsustainable practices. So upstream solutions are needed to change this landscape. And again, health professionals are well poised to help transform the system. Next. Next, I'm going to skip that one. So this quote deals with obesity, but I think it has more general application in this context. This is a quote from Dr. David Willinga, a healthcare professional who is very concerned about healthy food, and a national leader in this area. Our national obesity epidemic is but a symptom of a more serious illness, our unhealthy food system. In order to prescribe healthy food, we must rethink the entire system, from the farm to children's mouths. And I think that, as I mentioned, that has applicability for obesity, but when we think about the other aspects of health related to our food system, whether exposure to chemicals, an epidemic of cancer, climate change, that while not entirely caused by our food system, each can be linked back to our food system as a major contributing factor, and rethinking the entire system is the way that we need to go. Next. So I've emphasized healthcare plays the burden of dealing with the impacts of an unhealthy food system, and health has an essential role to play in creating healthier, more vibrant local food systems. In the next section, we're going to look at some of the ways that healthcare professionals and hospitals are serving up a menu of change, taking action in their practice within their facilities and the policy arena to create a food system that promotes health for people and the environment. Next. So there are many levels at which change can be made within healthcare, in your practice, in your institution, in a professional affiliations and professional associations, in the community, regionally, nationally, and globally. So there's lots of different ways that we can take action in different arenas. Next. In your practice, healthcare providers can be aware of and help educate patients about ways to reduce exposure to pesticides when purchasing produce, simply by being aware of and sharing information about the dirty dozen, the fruits and vegetables that are most likely to be highly contaminated with pesticides, and the clean 15, crops least likely to be contaminated. So this is an example of the dirty dozen, and if you look at the clean 15, these are like healthy foods that we can know that if we buy these, they're least likely to be contaminated with pesticides. Next. Another example is Yeah, healthier hospital food service. This is from Healthcare Without Harm, identifying some ways in which healthcare systems are leading in food service, such as healthier vending machine options or serving less meat on menus, reducing sugar-sweetened beverages. Next. It can also look like healthcare institutions as anchor institutions and communities, improving community food environments through programs like fruit and vegetable prescription programs, reducing waste and donating unused food to the hungry, and supporting health professionals to be effective policy advocates for better food systems. Next. Skip that one. Educating your peers is another important role to play by playing a leadership role within your institution as well as your professional associations, sharing what you know and learn, and that's another key way that you can make a difference. Next. Healthcare farming is another example. On the left, you have Henry Ford West Bloomfield, which is an organic hydroponic farm on site at their West Bloomfield Hospital in Michigan. And there's on the right is the farm at St. Joe's, which is also leading the way and helping create healthcare farming. Next. Farmers markets and farm stands are becoming much more common in this country, and they're also being used more widely at farmers, sorry, at hospitals. So the left is the Eastern Market Farm Stand at Detroit Medical Center. Yep, next slide. And I mentioned fruit and vegetable prescription programs. An example, this is shown here, is the fresh prescription program that I helped establish with the Ecology Center and Detroit Community Health Partners that links healthcare and food systems and supports a healthier local food system by connecting food growers, such as in this case the Eastern Market, with community-based health centers, clinics, and other sites in the community, so that physicians write or health providers write a prescription for fresh fruits and vegetables and provide a voucher that patients can then take to an on-site or off-site market to receive fresh fruits and vegetables. Next. And those are just some examples of those. The Fresh Prescription Program, Recipe for a Healthy Detroit, which we started again in Detroit, Wholesome Way, which is a national program operating in multiple states, and Prescription for Health, which is the program based in Washtenaw County. Next slide. Hold on just a moment. So there are many avenues for creating community partnerships around public health in the food system. Community benefits department in your hospital may work with some organizations already or be interested in developing connections with food-related organizations in your community. Many cities also now have food policy counselors or community garden organizations, or supporting corner store conversions to get fresh fruit produce into neighborhoods that are often considered food deserts. Healthcare professionals have a great deal of credibility and influence in matters of public health policy and can help legislators make the connections between public health and the food system. Simply calling your mayor's office or generating 3 or 4 handwritten letters from colleagues can have a surprising capacity to move policy. Next. So obviously, we hope you'll continue to be involved in the work of the Ecology Center, but there are other organizations working at the national level to bring about healthier food systems and to get chemicals out of our food system and to address these issues. And we hope that you will follow up with some of these resources that are working on making change nationally. And we hope you'll, pursue a partnership with us if this is an area that you're interested in. And that concludes my presentation. And hopefully we have time for some questions.
Great, thanks, Kathryn. So we are opening it up now. If folks have questions, feel free to unmute yourself and ask away.
I'll just make a comment because, you know, a lot of this, well, first of all, we went very fast through it, but I appreciate all the information. I scribbled notes and I'm glad it'll be online to review. But I was really excited to hear about the gardening at the hospitals. That's really, really cool. It reminded me again, and sometimes I'll bring this up. I worked in a prison for 14 months as a mental health worker, and in doing so, I learned that prisons used to be grow their own foods oftentimes. And the guys who had those experiences told me that not only obviously were they happy to have fresh foods, but it gave them a sense of purpose. And they really made something out of their time in prison. And I like the idea of sort of focusing on how that works at the healthcare level, and then maybe bringing it back at that level too, to like integrate the community and how they might come out and make use of their learned skills. And that's my comment.
Yes, thank you. I just wanted to add that one thing that I didn't mention about the farm at St. Joe's is that they have been using their greenhouse facility where they're farming as sort of a therapeutic, I don't know if it's therapy for their folks who are brain damaged, and again, giving people a sense of purpose and rehabilitation as they're farming. So they're growing food that they're using in the meals at their hospital. They also grow flowers that they give to patients. So there's a lot of ways that that can be really powerful.
I just had a question about the prescription for health and wondering how widely that's used, like in the community, even like in Ann Arbor or Washington County. Like, are all doctors aware of that or able to prescribe for that? And like, where is more work need to be done, I guess?
Yeah, that's a good question. So I can't speak very currently to what's happening in Washington County. They were definitely the model that the Ecology Center looked to create our program in Detroit, but I haven't been in touch with
Okay.
them very recently to know whether it's still continuing and funded. That's a good question. So the way it works, because we have never, one of the real struggles with the program is finding a sustainable funding mechanism to keep it going. So for example, getting it integrated into the food and farm bill would be like an excellent
Yeah.
thing, but we have not been able to accomplish that. And so a lot of the programs are grant funded or get integrated with sort of existing programs and resources. So we worked with individual health clinics across Detroit and the doctors and providers in those clinics. So that wasn't entirely open to the general public, just because you have to be able to
Okay.
afford the food that you're giving folks.
Yeah.
And
Yeah.
so yeah, finding that mechanism is something that we've really struggled with, and that a lot of people are trying to figure out across the country. But again,
Okay.
it's a question of looking at the resources that exist, and you can do a lot with very little if you have
Mhm.
a good kind of alignment of the healthcare partners and the food partners.
Okay. Great. Thanks.
All right, we're wrapping up the end of this hour, but any last questions or comments for Kathryn?
Just will we hear more about things like you mentioned briefly, nicotinamides in bees, and that the European community has made progress on that, but we have not? Is that part of this program, that kind of effort? And yeah, where is that? Why are we behind?
Yeah, that's a good question. I think that we can get you more information on that if that's an area of interest.
Yeah,
Yes.
Yeah.
And our colleague Melissa Sargent has led some of the pesticide work that we've done. And last year we did have a webinar with Friends of the Earth, which I believe covered some of that, which is available. Whether or not we do the same webinar this year, all of those webinars from previous years are available on our YouTube channel, and we can direct you to that.
Oh, thank you. That would be helpful.
And then Melissa, I'm sure, could answer any specific questions after folks are able to review that.
Thanks.
Mm-hmm.
All right, thank you.
All right. Thanks, Kathryn. So with that, we are going to be taking